Hello everyone, today's topic is on autonomic nervous system. Though it is a confusing topic, I make sure that at the end of this video it will be very clear for you so that you can answer whatever the multiple choice question which has been asked, and also for the short notes or any clinical implication. So the nervous system is broadly classified into central nervous system and peripheral nervous system. So the central means centrally located organs like brain stem, spinal cord contributes to the central nervous system, and the peripheral nervous system is contributed by the cranial nerves and spinal nerves. So for any action or for any system to work in our body, there should be an input and output. Okay, so the messages from the body and the organs, viscera, everything will be a sensory input to the central nervous system, wherein the central nervous system will give you an output as a motor output. Okay, so sensory neurons from peripheral to central and motor neurons from central nervous system to peripheral nervous system. So the input is coming from where? From the general body, so we call it as somatic, or the organs, that is viscera. So these two will give you an input from the peripheral nervous system to the central nervous system. Hence the central nervous system will give output to the body as well as viscera. In this, the viscera, it will be mainly composed of smooth muscle, cardiac muscle and glands. Okay, salivary glands, lacrimal glands, gastric glands, everything. So this particular component, the visceral component from the motor output of the peripheral nervous system, is called the autonomic nervous system. So the autonomic nervous system is the visceral component, which is the motor output in the peripheral nervous system. It is cumulatively called as autonomic nervous system. Why it is named so? Autonomic, auto, independent. Okay, autonomic nervous system. Auto means independent. It's not voluntary, it's involuntary in action. Okay, for example, cardiac muscle is involuntary. We cannot control it. Okay, since it comes under autonomic nervous system. So embryologically, where these cells of autonomic nervous system come from? It's from the neural crest cells. Okay, and then autonomic nervous system is broadly classified into sympathetic and parasympathetic. Simply to remember sympathetic, okay, it will be activated whenever there is a fight or flight reactions. That is stressful situation, sympathetic will take an upper hand. Parasympathetic mostly take an upper hand in the relaxed position like rest and digest. Okay, so these two are opposing, like stressful situation and relaxing situations are opposing actions, but it is important for the homeostasis. Okay, so in the next sections we will be seeing what is the sympathetic actions and parasympathetic actions. Okay. So now sympathetic, what does it contain? It contains the cell bodies that lie within the lateral gray column of the spinal cord. It is in the lateral gray column of the spinal cord from T1 to L2. Okay, this is an MCQ question. Where does the sympathetic, what does it contain? The cell bodies that lie in the lateral gray column of the spinal cord from T1 to L2. Then parasympathetic contain a cranial nerves number 3, 7, 9, 10. Remember 3, 7, 9, 10. And also the pelvic splanchnic nerves exit from S2 to S4. Okay, so we told it's for fight and flight, and this is for relax and digest. Both sympathetic and parasympathetic has preganglionic fibers and postganglionic fibers. So preganglionic fibers will release acetylcholine, which will activate the postganglionic to release a neurotransmitters. All these are neurotransmitter, either acetylcholine or norepinephrine. It's like ganglionic fibers of parasympathetic and post-ganglionic of parasympathetic both will release acetylcholine. Okay, but the post-ganglionic of sympathetic will alone release norepinephrine. Remember this. All will release acetylcholine except post-ganglionic fibers of sympathetic fibers. It's also an MCQ. Okay, and then sympathetic will exert an action on chromaffin cells of adrenal medulla to release epinephrine. This epinephrine will activate the adrenergic receptors like alpha 1, alpha 2, beta 1 to beta 3. Okay, so coming to the actions, you just remember stressful situation. So what happens in the stressful situation? The heart rate increases, cardiac muscle contractility increases. So whenever you run in a stressful situation, what happens? The bronchodilation happens, the pupil will dilate, sweat will come, so that blood flow to the muscle will increase, metabolism will increase, so the glucose in production will increase. So when the glucose production is increased, obviously lipolysis will occur, so that gluconeogenesis will occur, and ejaculation will be increasing, urinary output will decrease, motility, gut motility will decrease, because here we told no, parasympathetic is for relax and digest, so motility will be more in parasympathetic, but motility will be decreased in gut in sympathetic. And relaxation of the deducer muscle of bladder. Okay, bladder muscle will relax, urinary output will reduce, contraction of the urethral sphincter will occur, and whenever there is a stressful situation, immune function will get suppressed. Okay, and this will increase the cardiac contractility, but the dilatation of the coronary arteries will be there. Okay, you remember this. Coronary arteries will go for vasodilatation. Okay, and then this is mostly activated in the moments after waking up, and also in exercise, and mostly in the stressful situation. If you remember the stressful situation, you will remember all the actions of sympathetic nervous system. Coming to the parasympathetic nervous system, it's opposite. It's relax and digest. Okay, relaxed situation. So the relaxed situation, what happens? Heart rate decreases, cardiac muscle contractility decreases, so bronchoconstriction, pupil contract, increase in all the secretions. Okay, lacrimal, salivary, gut motility, contraction of deducer muscle, relaxation of the urethral sphincter. Here the glucose will not produce, rather glycogen will come. Okay, glycogen synthesis by the liver, and swelling of the clitoris, erection of the penis. Erection is by the parasympathetic, ejaculation by the sympathetic. Okay, activation of immune system. It's relaxed, no? So immune system will work well, activation. And parasympathetic will not exert much control over vascular tone. Remember, vascular tone will, that effect will be less in parasympathetic than the sympathetic. I hope you had a simple outline, clear outline on this. If you have any doubts, you can comment below so that I can upload on that. And if you like this video, kindly subscribe to the channel Dental Shots for the upcoming videos. Thank you.